Hi, you're watching Your Future, Your Finances. I'm your host, Brian Kuhn. We've got a great show for you today. This show is all about healthcare and taking care of people as they age or need help. So we have two great guests for you. We thank you for watching. My first guest is Rachel Boryachinskiy of Healthcare Deciphered.
Yes, thank you for having me.
Sure. Welcome to the show. So, Healthcare Deciphered, explain to us what that is, and we'll talk about the state of the healthcare industry.
Yeah, so Healthcare Deciphered is a new niche in healthcare. We're really partnering with individuals, families, and small businesses to help them navigate the industry, and that could be from anything from health insurance to claims issues to working with providers being physicians, hospitals, labs, radiology, pretty much anyone under the healthcare window. We can help navigate the industry.
And that's a huge industry with a lot of paperwork.
Yes, and that's actually what we specialize in best is, really simplifying and making the industry work for the individuals.
Mm-hmm. So in the healthcare industry, we're coming up on, help us with when that is, the open enrollment period, as they call it. So what is that, when is it, and what do people have to do during that time period?
Yeah, so open enrollment, there's a few different periods of time. Medicare is October to December, and the individual or employer market is also almost in that same window. And what happens is each year you have a period of time where you can review your benefits and health plans and different offerings, so you can elect for the next coming year. So in November, we'll pretty much be starting to look at benefits for 2017, and anyone that elects benefits at that time will have it for next year.
Mm-hmm. And that's employers need to do that, and then retirees, and then also anybody who has individual health insurance?
Correct, including most small groups and employer insurance also during that time frame.
So that's probably a pretty busy time period for you, I guess, helping people do that?
Yeah, I want to say 90% of, individuals, families, and businesses are looking at their health insurance during that time and trying to decide what's best for them, and it's a very difficult decision. Sometimes you have multiple options, and sometimes you only have one or two, and picking what's the best for you is always a very difficult decision.
Mm-hmm. And most of the time, I guess that's based on cost, right? So where do we foresee that going this year?
So for 2017, most people say it's going up pretty rapidly. I think for 2015 to 2016, we had a pretty significant increase. Mm-hmm. It almost went up into 30%. I don't think it's a little surprising.
Yeah.
I don't think it's quite going to go that high. I do think on the individual, and we call it Obamacare, the exchange plans, the proposed changes are about 13 to 20%, so in the double digits, so it's a pretty big impact. On the group insurance side, it's much less. It's about average 7%, and even actually a few plans have decreased costs slightly, but every little bit helps, so that's really good to know. But by and large, I think the industry is continuing to increase, and not even just with premiums and deductibles and on the health insurance side, but on the medical cost side, we're talking hospitals and physician services. Overall, I think we've seen from last year to this year, 2015 to 2016, it's gone up almost 14%. I don't think from 2016 to 2017 it's going to have that big of an impact. Mm-hmm. I think most people and myself are projecting about 7%.
Okay, and that's on the monthly bill that people pay, but then also there's increases, like you said, on the out-of-pocket stuff as well. So
Correct.
Everything's going up.
Exactly. What the physician bills the health insurance company, what the health insurance company has to get from you each month, overall it's increasing.
Mm-hmm. So this airs in Montgomery County, Maryland. What do you think residents of that county can do with once they get that increase?
I think the best thing, and my advice would be personally, is really to shop around. Even if you think you don't have options, likely you do, and there's different things that you can do to help with costs. I know we're going to get into that a little bit later, but one of the best things is looking at the language and the fine print in the contracts. Even if you only have maybe one or two options that you can viably afford, there's little things about applies to deductible or co-insurance. Anytime you see those two factors, you're going to pay a percentage of the overall cost. And a lot of times that's between 20 and 30%. So if your doctor bills you $110, you're likely going to pay 20 to 30% of that. Whereas if you have a copay, which is a flat rate, and that's all you pay, then you might pay $20 or $30 to see a primary care physician, or $30 to $50 to pay a specialist, but you're not going to incur any additional costs on the back end. So there are limited surprises. So the more benefits or services, radiology, lab, testing, prescriptions, where you can have a copay for those services, and you know that's the one rate you're going to pay, it's much more advantageous for the residents, and something they should definitely look out for.
And you can actually pick plans that are more copay driven if they look around for them.
Correct. Just because you have a higher deductible, and sometimes the deductibles get up into, pretty high. I've seen them go up to $10,000 for families. You can get a high deductible plan, but one with copays, and then you'll never need to meet that deductible to be able to use your services, and that's really what people want to target these days with the high deductible plans as they are.
Okay, great. We do have to take a break. We'll be right back. We'll talk more about how to save money on healthcare costs and also the business model that you have of Healthcare Deciphered. We're talking with Rachel Boryachinskiy of Healthcare Deciphered. We'll be right back. Thanks very much.